Hey guys, so welcome back to another one of our videos. And in this particular video, we're going to talk about, hiring a medical director for your home health agency. Now, this is pretty much for like a hospice or for a medical home health agency, but not really for a non-medical private duty home care agency. And so the reason why we're going to talk about this is because we want to be able to know what are the rules that are requirements, that we need to make sure that we abide by when we're hiring a medical director. And as well, not just why we should hire a medical director, but at the very same time as what are their duties, what's their responsibilities, and what can and they cannot do, especially how we can actually avoid any problems by, maybe violating the anti-kickback statutes as well, right? So let's go ahead and get started with the video, okay? So if you are planning to hire a medical director for your company, for your agency, let me share with you guys a few tips that I have used, that I've also taught a lot of people that I have consulted with, or at the same time, I have used for my own companies, okay? If I'm going to hire a medical director, I'm going to hire them because only for a reasonable, right? Only for reasonable service that I require them to do. I will not hire more than one medical director unless, of course, it's needed where you literally have those thousands of patients where you might need more than one medical director. The next thing is, do not hire a medical director because for the sole purpose, for the main purpose of getting referrals from them. Okay? Do not hire them if you've only looked at their qualifications, if they're actually qualified. You want to make sure they are qualified. Just because they're a physician, just because they have a license, that does not mean that they're qualified to become a medical director. Never, ever, ever, ever pay more than fair market value for the services that a medical director will provide for your agency. You want to be able to carefully document the services that he or she will be providing. Make sure that it is documented, it's written, it's videotaped. Whatever you need to do, it needs to be documented that they're actually doing what they're supposed to be doing under the policy and procedures, under the job description of that medical director. Every year, evaluate. You do this for your employees. Your medical director is technically your employee. If you're scared to evaluate this physician, this medical director, then don't hire them because they work for you. Just because they have a higher license, just because they have more education and a higher status, they are still an employee of your agency, okay? So when your doctors, when these medical directors are contributing to your company, I want to be able to kind of share with you guys on what these medical directors, how they can actually help your agency. They need to be acting as a liaison between your staff, your team, and other physicians that are referring to your agency, okay? Sometimes for people to be able to speak to someone in their level, they will be more respectful of another physician and things can be carried out even better. At the same time these medical directors should be coaches. They should be leading your team. They're part of the management. They can help answer questions that you may not have, and they can speak to your nurses, your therapists, when you're having in-services. They can help navigate and give you more patient information, more clarification, more education on the care of a patient. All right? Now, when these medical directors are working for you, you should have timesheets for them because your staff does not get paid unless they turn in their timesheets, right? It's the same thing for your medical directors. They should get paid on what they put in for your company. So make sure that they're turning in their time slips, especially if they're being paid per hour. Now, some physicians out there who are medical directors are given a standard stipend or salary. So if that's the case, they still need to show and turn in what have they done in for that week. Or are you just going to pay your nurse if they're not visiting patients? Of course not. These people, these medical directors, are your employees. And if they don't put in the time, then they should not get paid. So like I said, These medical directors, their job there is to be a consultant at the same time, to be able to help you provide care. They should not be hired in the sole purpose because maybe you can get some patients from them. It shouldn't be that way. All right, guys, you have to pay attention. These are rules and laws that are in place. And if you violate these laws, you can get in trouble. And I don't want you guys to get in trouble. I've known so many other companies that have seen them in the news, seen them in newspapers, seen them in vlogs. And you don't want to be those other agencies that are getting in trouble because they're being greedy. So I hope this video helped you guys out. Keep on watching more of our videos. Our goal here is to keep on educating you guys because we want to be able to let you guys know that home health marketing is easy when you know what you're doing.